This short instructional video will provide an overview of Milwaukee County Emergency Medical Systems Physician Medical Control. This is the process by which Milwaukee County paramedics call a physician on the radio for medical. The second-year resident is most frequently the online medical control physician, but they operate under the faculty oversight, and in certain circumstances, other trained residents or faculty may be called upon to provide online medical control. In this overview, we will discuss the base station equipment, base station resources, completing the medical command form, the 1099 checklist, and troubleshooting the process. The entrance to the online medical control base station is across the hall from the main trauma bay entrance. You can enter the room with badge access. The workstation consists of a computer, radio phone, and other resources. The primary base station is on the right. The other base station is for backup use, as well as when two calls come simultaneously. The radio setup consists of the base, headset, and hand button. Alternatively, a foot pedal can be used and is located under the table. Other resources available include, in the pictured binder, the hospital phone list, hospital designation list, research trial information, dopamine drip rate chart, physician doctor numbers, and troubleshooting information. In addition, the Milwaukee County EMS Medical Control Resources binder contains EMS protocols and EMS practice guidelines, which can also be found online. There is also a wall map and a list of med unit medications on the wall. The stacked file folders contain 1099 forms, backup paper medical command forms, and other miscellaneous resources. We will briefly review the medical command form. Starting at the top of the form, as always, the med number must be entered before the call begins. This important first step initiates the call and timestamps the recording. The pink boxes will be filled in automatically. Fill in as many of the blue boxes as possible. In the medical decision-making box, please enter a brief and concise description of the encounter and the medical decision-making. This should be completed in the SBAR format, briefly outlining the situation, background, assessment, and recommendation. Once the form is complete, enter your base doc number at the bottom along with your password. Remember, your username and password are both your first initial and last name. If it is an interesting, educational, or problematic case, please click the Review for QA box in the upper right. Finally, in the lower right, you must click the Signed box and click the Submit to complete the form. Here is an outline of the medical control process. We can start at the top with the green box. Follow the pathway outlined in red to the right. If the patient does not need transport or hospital notification is not necessary, you, the medical control physician, calls EMS-COM to notify of disposition. Following the pathway in blue downward, if transport is needed, the receiving hospital needs information and you will call EMS-COM and provide the disposition and elements listed. We no longer have to call the hospital directly. To summarize, in the fiery portion to your left, after all medical command interactions, call EMS-COM with report, not the hospital. These medical control pre-99 checklists can be found at the medical control base stations. They are divided into checklists for medical and for traumatic cardiac arrests. The resident online medical control physician should check off the appropriate items during their call. The 1099 forms are to be used to guide resident online medical control physician cardiac arrest care and to determine whether a faculty member should be engaged in decision support. Once the faculty is involved, their expertise should guide resuscitation. We will briefly discuss two troubleshooting scenarios. First, if you enter the room and the form is not up on the screen. This can happen periodically due to computer error or if the form is improperly shut down. To reopen the form, first open the Internet Explorer. Next, click on the Favorites button at the top of the browser labeled EMS Command Form. Of note, you can see other links to EMS policies and manuals to the left and the Zoll Online EKG Review to the right. Clicking the EMS Command Form button will result in a pop-up that asks you if you want to update Java or run this time. Select Run this time. Please do not attempt to update Java. Next, we'll open a window to enter your username and password. For the main station on the right, they are both EMS COM 5. For the secondary station on the left, a 2 is substituted for the 5. Next, click Log On. Finally, in the launch window that pops up, click the blue Go button in the lower right. Remember, if you have any trouble with this, you can always just use the paper form discussed next. If you are unable to use the electronic form for any reason, please complete the paper form found in the brown file folder near the computer. This form is simply a screenshot of the online form. The required areas are marked by a black circle and asterisk. These include the med number, the date, the start and end time, and your doctor number. Completed paper forms should be placed in the lockbox near the computer stations. Thank you for taking the time to review the online medical control process and for your continued work in providing online medical control for Milwaukee County Emergency Medical Systems. If you have further questions or concerns, please refer them to one of our EMS physicians, Drs. Weston, Colella, Liu, Lenz, Chin, or Liebeck. Thank you.